We will talk about non-alcoholic fatty liver disease. What's the idea of this disease? Idea is fat accumulation in the liver. And why it's important? Because 30% of world population affects it. And if you see obese person or overweight person, there is almost 100% probability that this person will have non-alcoholic fatty liver disease. And this disease has stages from just fat accumulation to inflammation and eventually irreversible liver damage, which is called fibrosis and cirrhosis. And cirrhosis has unfavorable prognosis. That's so important to spot and treat immediately fat accumulation in the liver, which is called non-alcoholic fatty liver disease. Now let's say what is mechanism of this fat accumulation. Most important mechanism is insulin resistance. When we have insulin resistance, we have high blood glucose level. When we have lots of glucose, our cells can't metabolize this glucose, can't burn this glucose as a fuel, and when there is excess glucose in the blood, this glucose is transported to liver. In the liver, it is converted to the fats, and this fat is accumulated in the liver. It's accumulated in other part of the body also, but firstly it accumulates in the liver, and we get non-alcoholic fatty liver disease. Another example is inflammation and oxidative stress. Inflammation and oxidative stress both damages cells and DNA, and they cause increased triglycerides, and also this damage of cells decrease ability of liver cells to metabolize fat and burn fat efficiently, and it causes accumulation this fat in the liver. And what looks like patient with fatty liver? What is classical patient? Such patient usually is obese, and second characteristic is elevated cholesterol level and elevated glucose level in the blood also is classical patient. And this patient may say that he has fatigue, weakness, and upper right abdominal pain. But fatigue and weakness and abdominal pain also, they are non-specific symptoms, and it's very difficult to differentiate. It happens because of fatty liver or other causes, for example bloating or gas formation. It's difficult to differentiate. It's non-specific symptom, but we should mention if person has obesity, elevated cholesterol, and high blood glucose level, this patient almost 100% probability will have fatty liver also, especially if this patient has fatigue, weakness, and abdominal pain. And undiagnosed cases are very common because, as we said, this disease have no symptom for many years, and sometimes more than 10 years fatty liver has no symptoms, and these symptoms are vague. When we have fatigue and weakness, person will not pay it attention as a liver disease. That's why the symptoms go unnoticed for years, and fatty liver is undiagnosed. And when it's undiagnosed and untreated, it has stages. First stage is when liver is normal. Second stage is when fats already accumulated in the liver and we have fatty liver. And third stage is inflammatory stage, which means that we have fatty liver and plus inflammation. And after this we get fibrosis and eventually cirrhosis. And cirrhosis is already a stage of disease, and people with cirrhosis will die in several years, and eventually they will develop liver cancer. So prognosis is not favorable if person already has cirrhosis, although such patients live several years. So but eventually prognosis is bad. That's why it's better and it's most important to stop process here. When person has fatty liver disease, we always get healthy liver from it, because liver is very resilient organ, and we can reverse process in many cases, and just weight loss is enough. And as we said, most important risk factors are obesity and insulin resistance. If person is obese, almost 100% probability he has fatty liver disease. And fatty liver disease can be with inflammation or without inflammation. If patient has no inflammation, it is called steatosis. And if he has or she inflammation, it is called non-alcoholic steatohepatitis. So inflammation is steatohepatitis. Fat accumulation without inflammation is steatosis. And non-alcoholic inflammatory fatty liver or steatohepatitis is called NASH also. And what is the probability that person with fatty liver will develop NASH or steatohepatitis? This probability is around 30%. And when person already has NASH, there is increased risk of cirrhosis. Around in 10 years or 15 years, this person will develop cirrhosis, and every patient with NASH or non-alcoholic steatohepatitis will develop cirrhosis in 15% probabilities. And when person has cirrhosis, after 5 to 10 years, such person will develop liver cancer. That's why this progress and this junction of different and progressive diseases such as cirrhosis and cancer is inevitable if we will not stop process here or here. In best cases we should stop process here, but in worst cases we should stop process when there is non-alcoholic steatohepatitis. And how we diagnose fatty liver? Biopsy is gold standard of diagnosis. When we take sample from liver and examine tissue under the microscope, and we can see this fat accumulation, we can see this fat deposition. And ultrasound is also important diagnostic method, and in many cases we don't do biopsy. Even its gold standard of diagnosis is invasive, so it's not in many cases, and we don't need it in many cases, because ultrasound and MRI is very informative methods. And what is treatment? We have treatment, and this treatment is called weight loss, and this weight loss is almost 100% effective. If you weight loss your body's 5 to 10%, it already importantly improve your liver health. That's why weight loss is crucial when person has fatty liver disease. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.